I don't need to convince you that healthcare needs reform. However, recent polls show that 80% of Americans are happy with their healthcare. The thing that these polls don't say is that the 20%, the people who don't like healthcare, is people like you. People who actually pay for healthcare. Costs have increased 100% over the last 7 years. Premium goes up and coverage goes down. All the time out-of-pocket costs for your employees inch up. There just doesn't seem to be any end in sight. But as someone who lost a wife to an HMO 21 years ago, I can tell you the answer isn't that government takes over our health care. I have a common sense solution. But to understand my solution, you first have to understand where the money goes. Nationally, the average amount an employer pays for health care per employee is about $5,000 a year. Now, if you pay for 100 employees, your healthcare costs are $500,000 a year. If you have 100 employees, 93 of those employees will receive less than $500 in benefits from the insurance company. The other 7 employees will be hospitalized and will be billed an average of $30,000. After your insurance company takes their provider discount, they pay about 30% of the bill, or about $9,000 to the hospital. What that means is that annually, your insurance company pays out less than $125,000 in claims for your employees. Let me say that another way. The insurance company takes in $500,000 in premium and pays out $125,000 in claim. For every $100 you pay out in healthcare premiums, your employees receive $25 in goods and services. Is there any other vendor you would pay $100 to get $25 worth of goods and services? So where does the money go that you spend on healthcare? Our healthcare system requires that to get healthcare, money must be exchanged. Let's break down the path your money takes to get healthcare for your employees. The insured, your employee, is over here. The doctor's here, and the hospital here. The money to access healthcare, doctors and hospitals, is here. Because you use your money to pay for coverage, you pick your plan based on premium. The plan you choose dictates your employees' co-pays, deductibles, and network of doctors and hospitals. You give your money to the insurance company to pay for a group plan that gives your employees access to healthcare dollars. At that point, it's no longer your money, it's the insurance company's. The point that is critical here is that you are paying a third party for access to their money. Your group plan includes all your covered employees. It's called your risk group. If you have employees that are sick or will otherwise file a lot of claims, that takes a fair amount of healthcare dollars. Another entity that takes a fair amount of your healthcare dollar is the government. Between lobbyists, political contribution, and government intervention, a good chunk of your healthcare dollar is left in your state capital, and even more is left in Washington, D.C. Now here's a dirty little secret. All healthcare plans don't reimburse doctors and hospitals at the same rate. So your plan may pay to make up for the shortages that other health insurance companies create by reimbursing doctors and hospitals less than yours. Also in line is big disease. These are nonprofit organizations who represent groups of diseases that put mandates on your healthcare plan. That means that whether or not you have employees that have heart trouble or diabetes, you pay increased rates for that coverage. Now, the drug companies have pushed themselves into line here by marketing directly to your employees. They encourage us all to take more drugs and to ask for their drugs by name, stealing more of the healthcare dollars that you pay for. All these groups get to your employees' healthcare dollar before they ever do. Now, once your employees do get their healthcare money to access their care, there are a couple of more entities that stand between their money and their doctor. First is the attorneys. In order to keep malpractice suits from financially destroying her and her practice, the doctor has to pay large malpractice insurance premiums. Plus, to stay out of the courtroom, she has to practice CYA medicine, running extra tests, many of them unnecessary. That whittles away more healthcare dollars. Then she has to pay billing personnel to go out and squeeze the little dribble of money that she gets from your health insurance company. If your employee becomes very ill and needs hospitalization, there are a couple of more people who stand between their money and their care. The first is the case manager. They are out to watch out for the health insurance company's money. Their job is to arrange for the least expensive treatment and find the cheapest doctors in their network. Then there's the claims department. It's their job to see that money is saved, denying treatment and often even denying payment of the claim. All of this is why your premiums go up every year. Doctor reimbursements go down, and only 25 cents of your healthcare dollar goes towards care. Let me ask you, would it help your bottom line if you could find a way for your employees to pay $50 and get $50 in goods and services? The Main Street Health Network plan gets all of this stuff, including you, out of the way. The simplest, most direct, and effective way to get health care is to eliminate the third-party payer system. We build a cash network of medical providers. This allows direct access to simple health care. Using the power of the network, your employees pay the doctors the same or less as the insurance companies. Using the network, $50 out gets your employees $50 worth of care. That same cash network will allow them to buy drugs at the discount the insurance companies get. Again, because of the purchasing power of the network. A very simple exchange, $1 out for $1 worth of goods. Now, the most critical component and most innovative part of the plan is insurance. The common sense ingredient of the system is pure insurance. Pure insurance is car insurance or life insurance. Pure insurance is there to cover you in the event of a catastrophic financial loss. Pure insurance is a financial tool whereby the insured pays a small, certain monthly amount to gain access to a large pile of money when a financial crisis arises. Car insurance, homeowners insurance, and life insurance are all pure insurance. In our plan, pure insurance takes its rightful place between the insured's money and catastrophic financial loss. In this case, a large medical expense. In our system, just like car or life or homeowners insurance, the insured actually pays pennies on the dollars compared to the amount of healthcare dollars they receive at the time of illness or injury. With a pure insurance policy, your employees get better care for less money because money goes to care instead of all this. Our custom employee reimbursement arrangement allows you to save, in most cases, 50% in healthcare costs. You can still help your employees pay for healthcare, but you can cut your costs in half. If you could save half on your healthcare costs, what would that mean for your business? Could you use that money to expand your business with marketing or make your life easier and your business more efficient by hiring someone to take over some of what you do? Whether you pay $10,000 or $1 million for healthcare, we can show you how to cut those costs in half. We can save you half on your current healthcare expenses immediately. I suggest we start now.